All right, so welcome back. As I told you, we are going to manage pneumothorax. So with pneumothorax, it is basically managed using what we refer to as a test tube. And we are going to see what we mean by a test tube. So by the end of this lecture, you should be able to know what a chest tube is and probably where it is exactly is inserted with a patient who has pneumothorax, but also other indications for inserting a chest tube. Now, a chest tube basically works on which kind of people. What do we use a chest tube for? These are the things that we call the indications of a chest tube. Now, we use it for evacuation of a pneumothorax. Yeah, what we actually talked about. Yeah, pneumothorax. Then we use it for evacuation of large fluid collections. Yeah, like chylothorax, empyema, and hemothorax. Now, chylothorax is basically accumulation of lymphatic fluid. Yeah, accumulation of lymphatic fluid. Lymphatic fluid within the pleural cavity. Yeah, while empyema is accumulation of pus. Accumulation of pus within the pleural cavity. And hemothorax, we say it is basically blood. Yeah, blood within the pleural cavity is hemothorax. Yeah. Now, so a chest tube is basically used for those indications. And remember, we talked about spontaneous pneumothorax. If it is small and it is not very big, then it can be removed or it can dissolve by itself. So you basically don't need to insert a chest tube. Now, if the pneumothorax is under tension, yeah, if in case it is tension pneumothorax, as we said, or as we mentioned earlier on, where the very first thing they do is to insert a large bone needle, usually inserted in the second intercostal space. Yeah, so they usually insert a large bone needle to make air escape. Yeah, however, if it reaccumulates or if it comes back, then we need to insert a chest tube. And usually it is inserted in the fourth, fifth, or sixth intercostal space. Yeah, in anterior, in the anterior axilla line. Yeah. So when you see your axilla, yeah, this is my axilla. So we have the posterior axilla, then the anterior axilla. So anterior axillary line, yeah, in the fourth, fifth, or sixth intercostal space, that is where we do place the chest tube. And as you can see, if it is fluid, we usually insert it a little bit lower, yeah. And if it is air, the chest tube is inserted a little bit higher, yeah, because the fluid pushes down by gravity. Now, that diagram basically shows us how a chest tube is inserted. Now, what you need to know is that a chest tube basically operates on a 3-tube, bottle system, yeah. And just to demonstrate that a little bit, you have your 3 bottles, and those bottles, one is basically coming from the patient, as you can see in the diagram here. One is coming from the patient, then another bottle, which we refer to as the seal, the water seal bottle, and then another one is basically leading to suction, as you can see in the diagram there. Now, the one that is leading from the patient, as you can see, basically collects things like fluid, any fluid, either pus or lymphatic fluid or blood, yeah? So we refer to that as the collection chamber, yeah? That very first bottle is referred to as the collection chamber. And it basically collects, it can either collect blood or fluid or any kind of fluid, yeah? It is referred to as the collection chamber. Now, the air, remember, you might also have air, pneumothorax, yeah? So what actually happens is that the air is non-collected in the collection chamber, yeah? The air escapes yeah, and as you can see, basically goes through this tube, yeah, and then it is bubbled, it dissolves into the water, yeah, and this chamber here, this second chamber here, is what we refer to as the water seal chamber, yeah, the water seal chamber, yeah. Now that chamber there that you can see usually has bubbles, yeah, bubbles that you know, they are not vigorous, but you know, the you know, bubbles that you know, but not so vigorous, but it has kind of like bubbling, yeah, some little bit of bubbling because of the air that basically you know, dissolves in it. Now when that air dissolves, it basically is again absorbed via this other chamber, which we call the suction chamber. The third one is called the suction chamber. The third one is called the suction chamber. Suction chamber, yeah, which is referred to as the suction. It is referred to as the suction chamber. Now, of course, the suction chamber, we have, you know, suction, yeah, like for example, wall suction, yeah. Now, that is the principle on which the chest tube works, yeah. Now, those are the three bottles, yeah. However, those three bottles in a commercial chest tube, they are all in one, yeah. Those three bottles are all in one, as we are going to see, yeah. So basically, as you can see there, the chest tube is attached, or it is connected to a patient, yeah, at the places at the intercostal spaces that we talked about. And then you have drainage, then you have air, the water seal chamber, and then we have you know, the suction or the pressure regulating you know, bottle. Now, so it basically looks like that. If you can see it, yeah, it basically looks like that, yeah. So if you can see, it is a 3-in-1, yeah. It is a 3-in-1. We have a collection chamber. We have a collection chamber, yeah. We have and the collection chamber is here. We have a water seal chamber, and then the suction chamber, yeah. So we have a 3-in-1. It's a 3-in-1 compartment, yeah. Now, usually especially in the poor resource countries, yeah, there's usually improvision, yeah, improvision, and you know, instead of using a typical chest tube, yeah, they improvise with the bottle, yeah, a mineral water bottle. That is basically they put the tube that is coming from the patient into a mineral water bottle. They fill it with the fluid, and then they dip the tube in there. Now that acts as it can act as you know, an improvision, and it works, yeah. It has been shown to you know, to work. However, it is not as efficient as the water seal chamber that we know, yeah. So basically it works, but it is not as efficient as the water seal chamber that we know. Now the other one, basically the collection, as you can see in this diagram, this is the one that is commercial and is actually outside there being sold. And so it collects from the patient, yeah, it collects from the patient, and for that case, the patient is able to, you know, so it collects until the bubbling, the little bubbling within the water seal chamber ceases. So that basically means that there is no more air being collected. Maybe one thing that I should have mentioned is that within the water seal chamber, we usually have what we refer to as tidling. In other words, as the patient breathes in, you see some water going up. Yeah. As they breathe out, then you see some water moving down via this tube here. This tube here. So that is what we refer to as tidling. Yeah. Tidling. Yeah. So you see tidling within the water seal chamber. And then you see bubbling. Yeah, you're supposed to see bubbling. Yeah, you know, some kind of continuous bubbling within the suction chamber. Yeah. So basically, that is that about you know, the chest tube and what it is used for. Yeah, we said it is used for 4 indications. Yeah, pneumothorax, fluid, or even fluid collections, either chylothorax or empyema or you know, hemothorax. Yeah. So basically, that is what I wanted to show you as far as the management of as far as the management of pneumothorax is concerned. So please access the video so that you should be able to watch. And also, I advise you to, you can go to YouTube and see some of these videos, how it is inserted and how it is basically managed. So please endeavor to do that, yeah, on your own. As for now, basically that marks the end of our lecture in pneumothorax. All right. Thank you so much.